Hello everyone. Today, we're diving into the world of a medication called Guanfacine, commonly known by its brand names, Intuniv and Tenex. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Guanfacine is an oral tablet that falls under the category of alpha-2A adrenergic receptor agonists. Its primary function is to improve nerve cell function in the brain, which helps with attention and impulse control. Initially approved by the FDA in 1986, it's primarily prescribed for the treatment of attention deficit hyperactivity disorder, ADHD, in children and adolescents aged 6 to 17 years. Guanfacine can also be used to manage high blood pressure, although this use has become less common with the development of newer medications. Warnings: Guanfacine comes with its set of precautions. It's important to avoid abrupt discontinuation of the medication, as this can cause a rapid increase in blood pressure. Patients should be monitored for symptoms of hypotension, bradycardia, and sedation, especially when starting the medication or increasing the dose. Caution is also advised for those with a history of heart disease, stroke, or depression, as Guanfacine can exacerbate these conditions. Before taking this medicine. Before starting Guanfacine, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its ingredients. Given its impact on blood pressure and heart rate, those with cardiovascular conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of blood pressure and heart rate is advised during the treatment period. You should not take Guanfacine if you have severe heart conditions or if you are allergic to any of its components. It's also not recommended for individuals who are taking certain medications that can interact with Guanfacine, such as other antihypertensive agents or sedatives. Before starting the medication, inform your doctor if you have ever had liver or kidney problems, a history of mental health conditions, or any significant health issues. It's also essential to let your healthcare provider know if you consume alcohol or take any other medications, including over-the-counter drugs and supplements, as these can interact with Guanfacine. Side effects: all medications can have side effects, and Guanfacine is no exception. Some individuals might experience drowsiness, fatigue, or dizziness, especially when starting the medication or increasing the dose. Other common side effects include dry mouth, constipation, and decreased appetite. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of more serious side effects such as low blood pressure, hypotension, slow heart rate, bradycardia, and syncope, fainting. If you notice any signs of these conditions, such as severe dizziness, lightheadedness, or fainting, seek medical attention immediately. Other potential side effects include mood changes, irritability, and depression. If you experience any changes in mood or behavior, it's crucial to get medical help right away. Furthermore, Guanfacine may cause severe allergic reactions in some individuals. Symptoms can include rash, itching, swelling, severe dizziness, and trouble breathing. If you experience any of these symptoms, seek medical help immediately. Interactions: Guanfacine might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Guanfacine can interact with other central nervous system depressants, antihypertensive agents, and certain psychiatric medications, which can increase the risk of side effects. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Guanfacine. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Guanfacine for treating ADHD in children and adolescents is typically started at 1 mg once daily, taken in the morning or evening, with or without food. Depending on the response to the medication and based on your doctor's advice, this dose may be gradually increased. For hypertension, the dosage and regimen may vary, so it's essential to follow your doctor's specific instructions. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while on Guanfacine, it's advisable to avoid consuming alcohol as it can increase the risk of drowsiness and dizziness. Given the potential for sedation, it's wise to be cautious when driving or operating heavy machinery until you know how the medication affects you. As with many medications, it's recommended to avoid abrupt discontinuation to prevent a rapid increase in blood pressure. FAQ. Many wonder about the age restrictions for Guanfacine. Currently, its safety and effectiveness in children younger than 6 years are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Guanfacine. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.